Hello everyone, welcome to today's section. Today we are discussing about the human diseases caused by bacteria. Myself, Sri Lakshmi, 2nd MSc Biology from St. Mary's College, Thrissur. There are several kinds of human diseases caused by bacterium. Today we can discuss about the cholera, tetanus, typhoid and leprosy. So today we can first discuss about the cholera disease. Of course, cholera is a bacterial disease caused by Vibrio Cholerae bacterium. This bacterium is mainly found in the contaminated foods and also in the places where there is lack of sanitation facilities. If the cholera disease is left untreated, it may cause severe diarrhea that will lead to dehydration in the body. Vibrio cholera is a curved and comma-shaped gram-negative bacterium. It is mainly present in the coastal saltwater areas. This bacterium is mainly lives in the small intestine of human, which will release an exotoxin that causes the flow of water and certain electrolytes. The cholera disease is also known as blue death because cholera infected person's skin may turn bluish grey because of the extreme loss of fluids. The cholera disease is caused due to the consumption of contaminated food and drinks which are sold by the street sellers, contaminated seafoods which are polluted with sewage, and also from the vegetables that are grown with the use of water with the human waste. The mode of transmission of cholera disease is by drinking water or eating food contaminated with cholera bacteria. The disease can spread rapidly in the areas with inadequate treatment of sewage and drinking. This infection or the disease is not spread directly from one person to another. Therefore, the casual contact with an infected person is not a risk factor for becoming ill. The main symptoms which is shown by the cholera infected persons are high fever, weight loss, increased thirst, feeling nausea, vomiting, kind of bloating in the belly, low blood pressure. The elasticity of skin become lost. On muscles cramps will develop, increased or rapid heart rate and formation of blood or mucus, and also the dryness in mouth, nose and eyelids. We can diagnose or identify the bacteria in a stool sample. For the quick confirmation in remote areas, dipstick tests are available. The quick confirmation will also help to decrease the death rate. We can prevent or control the cholera disease by drinking plenty of water which is boiled, avoid the consumption of raw foods and dairy products. The vegetables and fruits must wash before use, and also washing hand before eat is a good way to keep the disease away. We can treat the cholera disease by replacing the electrolytes or fluid which is lost and drinking of plenty of ORS, that is the oral rehydration solution, which prevent dehydration, and also the antibiotics and zinc supplements will use in the treatment of cholera. Next, we can tell about the tetanus disease. It is a bacterial infection also known as lockjaw. It will cause the stiffness in muscles which is present in different parts of the body and also affect the nervous system. It is a fatal disease of nervous system which is caused by the bacterium Clostridium tetany. The bacterium Clostridium tetany is also found in the soil, feces, and the digestive tract of animals. It will enter the body through a minor cut or wound when a person comes in contact with the contaminated matter. Tetanus disease also found in all parts of the world, but it more occur in the places having a hot and wet climate where the soil contain a lot of organic matter. Clostridium tetany is a spore-forming, gram-positive, slender anaerobic bacterium. It is sensitive to heat and it cannot survive in presence of oxygen. They produce two exotoxins, namely tetanolysin and tetanospasmin. The bacterium Clostridium tetany can remain inactive in the soil for very long periods. The pores of the bacteria are the reproductive bodies which infect a person, and also the pores of bacteria can be found in the soil and animal feces. The tetanus infection can be caused by burns, insect, animal bite, chronic sores and infection, puncture injury from the piercings, tattoos or injection, open wound contaminated with the soil, feces, dirt or saliva, and also by the dental infection. The tetanus disease is begin in jaw, so it is known as lockjaw. Sometimes the tetanus disease lead to some breathing complications in the muscles take part in the breathing process. Some of the common symptoms which is shown by the tetanus patients are fever, drooling, irritability, rapid heart rate, feet spasms, excessive sweating, high blood pressure, swallowing difficulty, and the uncontrolled urination. Therefore, no hospital lab test to confirm the tetanus. So, the doctors can diagnose the disease by examining the signs and symptoms shown by the patients. We can prevent or control the disease by vaccination and also by the good wound care. Sometimes doctors also use some medicines in the case of doesn't have protection from the tetanus vaccines. Being up to date with the tetanus vaccine is the best tool to prevent the tetanus disease. The immediate and good wound care can also help to control the infection. Don't delay to take the first aid of even minor or non-infected wounds. Wash the hand often with soap and water or use an alcohol-based hand rub if washing is not possible. The treatment of tetanus depends on the severity of symptoms. We can treat the disease with a variety of therapies and medications such as cleaning of wound, use of muscle relaxers to control the muscle spasm, use of antibiotic like penicillin to kill the bacteria, tetanus vaccination, and also the use of TIG, that is tetanus immune globulin, to neutralize the toxin. The next disease we have to study is typhoid. Typhoid is an infectious bacterial disease mainly spread through the contaminated food and water and also due to some poor hygiene conditions such as cholera disease. It is caused by the bacterium Salmonella Typhi. The first case of typhoid fever was reported in US in early 90s and about 21 million people are infected with the disease annually. Furthermore, scientists have identified two types of typhoid causing bacterium, namely ST1 and ST2. The bacterium Salmonella typhi is also called Salmonella enterica serotype typhi. It is a gram-negative bacterium characterized by thin cell wall and an outer membrane. The cells of this type of bacteria are reddish in color and have some black stains in the center. They are rod-shaped bacteria which grows in the small intestine of human body. Human beings are the main host of this type of bacteria and they can survive in the environment which are rich in oxygen. These type of bacteria enter the human body through the contaminated food and water and they pass into the intestinal cells of human body. Later it passes through the bloodstream, it destroys the lymphatic system and spread throughout the body. This type of bacterium is mainly carried out by the WBC present in the liver and also in the bone marrow. There they multiply and re-enter the blood cells which in turn cause a number of symptoms to appear in the later stages. The typhoid and para-typhoid fever is mainly transmitted through the fecal oral route. The causative agent or the bacteria passed in the feces and urine of infected person, which may contaminate the food and water and also cause infection in those who have consumed with the contaminated items. The type of food which are susceptible to contamination include the shellfish, raw fruits and vegetables, unpasteurized milk and the dairy products. The incubation period of typhoid fever is usually 7 to 14 days and that for para-typhoid fever is 1 to 10 days. The symptoms usually displayed by the affected patients are abdominal pain, constipation, ulcer, severe headache, dehydration, high fever and weakness, skin rashes, loss of appetite, and also the diarrhea. We can diagnose the typhoid fever by analyzing the sample of blood and urine. The another accurate way to diagnose the typhoid fever is testing the sample of bone marrow. But getting the sample is both time consuming is very painful. So it is usually used if other tests are inconclusive. We can prevent the disease by vaccination. There are two forms of vaccines available. One is oral form and the another one is injectable form. The vaccines provide protection only from 2 to 5 years. The oral vaccine is contraindicated in patients with depressed immune system. We can treat the typhoid fever by using the antibiotics. The antibiotics and also supportive care have reduced the mortality rate. Several antibiotics are effective for the treatment of typhoid fever, such as chloramphenicol, ciprofloxacin, and ceftriaxone. The final disease we have to discuss today is leprosy. Leprosy is a chronic infection that affects the skin, mucous membrane, nerves, eyes, and the upper respiratory tract. It causes discoloration, lumps, disfigurement, and deformities in the skin. Actually, leprosy is not infectious, but it is spread when a healthy person comes in regular and close contact with mouth droplets of leprosy patient. The children get affected by the disease rapidly more than the adults. There are 6 types of leprosies, mainly classified depend on the severity of symptoms. The first one is intermediate leprosy. It is the earliest stage of leprosy. In this stage, the patients suffer from flat lesions which may heal them by themselves without progressing in case of strong immunity. Next one is tubercular leprosy. It is the mild and less serious type of leprosy. Here, the people suffering from this disease have some patches of flat and pale colored skin. They have no sensation in the affected area because of the nervuses are damaged. The other one is borderline tubercular leprosy. Here, the symptoms at this stage are quite similar to tuberculosis, but the infections may be quite smaller and more in number, which may continue and revert to tuberculosis. The other type of leprosy is mild borderline leprosy. Here, the signs and symptoms of this stage are quite similar to the borderline tubercular leprosy. It includes reddish plaques with the numbness which may regress or progress to another form. The other one is borderline leprosy. It is the cutaneous type of condition and the main symptoms include multiple wounds or scars including plaques, flat, raised bumps that may continue to or regress. The last one is lepromatous leprosy. It is more severe type of disease with many lesions of bacteria. The affected region is full of bumps, numbness, muscles weakness and rashes. The other symptoms include limb weakness, hair loss and other body parts such as kidney, nose and the male reproductive system are also affected. It is more infectious than tubercular leprosy which never regresses. Leprosy is caused by the slow-growing Mycobacterium leprae. Leprosy is also known as Hansen's disease. The close physical contact with an infected person is necessary to transmit the disease. It is spread by the casual contact with an infected person such as shake hand, hugging, sit next to them. But it is not transmitted by the sexual contact. Mycobacterium leprae is a strongly acid-fast rod-shaped bacterium which is gram-positive. The The leprosy first affects the skin and then move on to the peripheral nerves. Although it takes 3 to 5 years for these symptoms to appear after coming in contact with the bacteria. In some cases, symptoms appear after 20 years. If the incubation period increases, then it is very difficult to doctors for diagnose the disease. The symptoms of leprosy disease include severe pain, bleeding nose, growth on skin, enlarged nerves, thick skin, ulcer, paralysis, eye problems, non-sensitive lesions on the body. The diagnosis of leprosy is based on the sign and symptoms. We can diagnose the disease by a skin test or skin lesion biopsy test. To detect the type of leprosy, lepromin skin tests are used. We can prevent the disease with the BCG vaccination. It is a single dose vaccine which provides 50% or higher protection against the disease. The another way to prevent the spread of leprosy is the early diagnosis and the treatment of people who are infected. We can treat the disease with a combination of antibiotics called multi-drug therapy. Typically, 2 or 3 antibiotics are used at the same time. These are dapsone with rifampicin and clofazimine. Thank you.